Like Kevin mentioned, I'm Ashrita Saran, and I would be talking about developing evidence and gap maps to identify equity issues. The first up is, why do we need to talk about equity issues in mapping? So what you see on the screen right now, on the right-hand side of the screen, is a knowledge brokering pyramid. What you see on the top three level corresponds to decision-making products that includes evidence portals, guidelines, and checklist. That helps decision makers take decision without actually having the need to look at the research papers and systematic reviews. But to get to the top level of the evidence pyramid, it's also important to have a stronger base in the form of existing systematic reviews and impact evaluations. And evidence and gap map, they're actually the link between the top of the pyramid and the base of the pyramid, because they help us identify available and relevant evidence on a particular sector and a subsector. They also help us identify existing areas of evidence concentration and also highlight the areas of key evidence gaps. Now, hence, it becomes extremely important if we want to identify to what extent the current research incorporates equity. We need to develop and design more equity-sensitive evidence and gap map. This will also help us understand and make more research and funding decision as per the available research on equity-related impact evaluations and existing research on that. Very quickly, what exactly are evidence and gap maps? Evidence and gap maps are actually matrix of interventions and outcomes, where your columns corresponds to your outcomes and interventions are mapped against your rows. The different bubbles that you see on the screen, they correspond to the type and volume of evidence, and the color coding that you see here help us identify the confidence in study findings. Like I mentioned earlier, they help us identify areas of evidence concentration, which you can see here highlighted in green. And they also help us identify areas of evidence gaps, which you can see here highlighted in red. And this is basically a snapshot from an evidence and gap map on violence against children, which was funded by UNICEF and Ochenti, and I was one of the co-authors for this. Now, coming to the important question, how can we develop and identify equity issues in mapping? So for an evidence and gap map, an evidence framework is of utmost importance. And evidence framework comprises of two important dimensions. One is called as the primary dimensions of the map that corresponds to the rows and column headings and subheadings. And usually for an effectiveness kind of map, it corresponds to interventions and outcomes. An evidence framework also corresponds with the secondary dimensions that includes your study design, country and region, and population subgroups. Now, equity can be incorporated in both of these dimensions. To incorporate equity component in the primary dimension of the gap, there are two ways to do that. By including interventions that target vulnerable population or that aim to reduce inequalities. And the second way is by analyzing outcomes that are specific to vulnerable population and assessing the impact on disadvantaged populations. I'll give you an example of an evidence and gap map that incorporates both of these components, and this is on interventions for people with disabilities. So if we talk about the intervention components here that are specific to this target group, that included anti-bullying policies and program, it included inclusive education and rehabilitation interventions. Similarly, if you talk about the outcomes that were specific to this target group, it included outcomes such as community attitude, discrimination, access to justice, and social identity. Talking about how can we incorporate equity into the secondary dimensions of the map, let's talk about in terms of the study designs. So evidence on equity impact may come from a range of study design depending upon the EGM topic and the sector that is your research question. For example, if you talk about evidence and gap maps on interventions for people with disabilities, it was an effectiveness kind of map, and randomized control trial and quasi-experimental studies can be assumed as obvious choices. However, if you look at the research that is out there on people with disabilities, most of the research on rehabilitation intervention are actually assessed through single subject design in practice with the available evidence that is out there. So if you're not mindful in terms of including this study design into our evidence and gap map, there's possibility that we'll miss out on a number of evidence, and it can be seen as an evident gap, which is actually not the case. Similarly, if evidence and gap maps, they tend to include policy relevant intervention, non-randomized studies such as natural experiments may get included. And like I mentioned, missing out on relevant study design can be highlighted as a gap. which is actually not the case. Secondly, incorporating equity component in the population category. So here we aim to extract data on the extent to which evidence and gap map provide evidence relating to particular vulnerable group, mainly including the Progress Plus category. Some of the most common listed population subgroups in various evidence and gap maps can be important as age in terms of highlighting children and elderly. Similarly, the important population subgroups like people with disabilities, income groups, gender, ethnicity, religion, and people belonging to conflict-affected populations. Another important consideration whenever we are talking about equity issues in evidence mapping is your search terms and the databases that it gets included. It is important to have searches which are sensitive and equity focused. There are three things to consider here. One is we need to have our search terms that are equity focused, like you can talking about incorporating search terms such as marginalized groups, socioeconomic status into your search queries. Secondly, we have to be mindful of search filters that are available in various databases that are equity focused. And the third important point is identifying databases. So whenever we talk about equity related research that is there in practice, both in health as well as in social sciences, they are not very relevantly available in academic databases. Most of these research, they are available through gray literature, through snowballing, and most importantly, through stakeholder mapping and through stakeholder consultations, because they can help us identify even the unpublished literature that might be out there and we might not be aware of. So I think these are some of the common sources to identify equity-related research on your topic area. Let's look at some of the examples on how we incorporated equity-related issues in mapping. There are two ways in which majority of maps consider equity. One is maps, they either include studies that have an explicit equity focus on a specific dimensions of inequity, such as disadvantaged population. An example of such a map is interventions for people with disabilities in low-income countries. And another way a map have been using incorporating studies that might not be explicitly aimed at reducing equity, but they do suggest data disaggregated by gender and disability. There are majority of maps that use this approach. Some examples could be evidence and gap map on road transport, evidence and gap map on child well-being, violence against children, though they might fall in the first category as well, specifically the violence against children. Let's look at the disability evidence and gap map. So this was an effectiveness map, and it helped map the interventions to improve well-being for people with disabilities and LMICs. So like I mentioned, for the population group is again the disadvantaged population, but we included traditionally underrepresented group as well in this evidence and gap map. That was children in care, conflicts, children belonging to conflict settings, migrants, and people belonging to ethnic minorities. What you see here on the screen is a snapshot from the people with disability evidence and gap map that included 274 studies, out of which 110 were reviews and 164 for impact evaluations. Like I mentioned, in the interventions and the outcome categories, that is the framework, we have intervention that are specific to that population subgroup, like self-help groups and disabled people's organization. Similarly, we had outcomes here that are specific to that population group, like stigma and discrimination and access to social protection programs. We can also present and analyze the population and other filters related to equity and evidence and gap map. Like you can see a snapshot here, and we can apply the filters and see evidence that are specific for that population subgroup, like disadvantaged population or migrants. I want to highlight one example of, like I mentioned, an evidence and gap map is not a means to an end, but they actually step towards further work. So this is an example from the SEDL and the disability evidence and gap map. So way back in 2017, our colleagues from 3I, they developed a map of maps. And through that, it was identified 3 areas that did not have many evidence and gap maps, or they were scarcity of evidence in that area. These 3 areas were disability, access to justice, and transport. Now, disability specifically, it highlighted the scarcity of evidence on effectiveness of disability-related programs in that area. Now, as a result of that disability evidence and gap map, we were able to highlight 2 important aspects, that most of the intervention in this area were actually the medical model of interventions rather than social. For example, we had interventions that for aiming at the population characteristics like social skills, rather than the structures of interventions like readiness of schools to include people with learning disabilities. So with this in mind, we went ahead and and implemented and produced 4 systematic reviews in this areas. They are still ongoing. One is, again, I guess, again, in the peer review mode. The 4 intervention areas that were identified as a result of this disability evidence and gap map for education, livelihood, social inclusion, and empowerment. And all of these 4 reviews, again, incorporated interventions that were specific for this people with disability and also had outcomes that were specific for that subgroups. Now, as a result of this review, currently, International Center for Evidence in Disability have also highlighted, have also went ahead and funded and produced a disability evidence portal. Now, this disability evidence portal will use evidence from these systematic reviews and will plot the evidence to make it accessible and usable for decision-making bodies across the LMICs and across the world. So you can see that starting with evidence and gap maps, how this equity issues were always remain constant, and it was now being used as a decision-making body like disability evidence portals as well. Another example is mega map in child well-being and LMICs. Again, this was a mega map that included 536 systematic reviews and 25 evidence and gap maps, and it included interventions to improve child well-being in low and middle countries. What was important is, out of this 536 systematic reviews, we were able to identify only 29 systematic reviews and 7 EGMs that had an explicit equity focus. So you can see there's definitely gaps in terms of equity focus in these systematic reviews. But what is also interesting to note that out of this 29 systematic reviews, there was some high quality systematic reviews as well that can be used by decision-making units to identify and use it for decision making. Now, to identify these 29 systematic reviews, we use specific equity terms in our evidence maps, like equity, equality, girls and women, disability, ethnicity and race, street-connected children, poor and disadvantaged population, and minority indigenous groups. Now, like the disability example, even with the mega map child well-being, once it was published and we had a lot of stakeholder consultations, another important area was identified to do evidence mapping, which was violence against children. Again, this was also funded by UNICEF Educenti, and this is already published and it is online for access. Now, some important consideration whenever we talk about equity in mapping is stakeholder consultation is extremely important part of developing and designing evidence and gap map because it aims at participatory research. And it is also important because they might direct the research question to incorporate equity and also help define the scope, context, and help us identify literature sources that will facilitate active dissemination. Also important to provide conceptual framework that shows pathways through which these interventions is assumed to affect the equity. Another important point is setting the inclusion and exclusion criteria to assess categories of disadvantage using Progress Plus. Developing equity-focused search strategies, again, important in terms of identifying your databases and identifying concepts in search terms. It is also important to develop a standardized data extraction tool to identify and code equity-related issues in terms of PCOs, as well as to identify any additional equity-related issues. And of course, in terms of visualization, having equity folders for ease of presentation and ease of dissemination. We have guidelines from Campbell, which is the Campbell Conduct and Reporting Standard Checklist, which specifically mentions consideration for equity and talking about specific population subgroups when designing and conducting evidence and gap maps. In concluding, I would just like to highlight that there's substantial research agenda to uncover about what is known and what is successful and what is unsuccessful approach in promoting more equitable development. And hence, it is important to design evidence and gap map within equity focus to allow identification of all the reviews which present evidence data which are disaggregated by a specific population subgroup or its specific equity-related issues. With that, I would like to thank you, and I look forward to your questions.
Thank you, Asrita. It's a great presentation and generated, I think, a few questions. I think in the chat. So just thanks. I guess I wonder if you could just begin to just highlight the difference between a scoping review and an evidence gap map.
Okay, so I think there are 2 or 3 important distinctions apart from others. So one is in terms of evidence and gap map helps us visualize the evidence because it is based on the framework. And for an evidence and gap map, the framework is actually the guiding step in terms of all the further steps. So framework is of paramount importance in terms of the inclusion criteria, in terms of how you visualize it, in terms of the presentations. That is important. Secondly, there are certain aspects in evidence and gap map that are mandatory, which are not so in terms of scoping reviews. Like it is advisable for evidence and gap map to have confidence ratings for systematic reviews, which is not mandatory or advisable for scoping reviews. There are also ways in which the analysis and how the filters are analyzed, which is mandatory for evidence and gap map, which is not so in terms of the scoping reviews. And also importantly, in terms of the use of evidence and gap map and the scope. So evidence and gap map, they usually have a broad scope, but if we talk about scoping reviews, it is not always mandatory for scoping reviews to have a broad scope. It entirely depends on the research questions, but in evidence and gap map, it definitely has a broad scope if we talk about the differences.
Thank you. I see Olivia Megwood, and you might have is asking about online tools or software to help authors create evidence gap maps. I believe this has been access to this from Cochrane, I think maybe the focus of this question.
Sure. So for Campbell collaboration, we use Epi Reviewer. So Epi Reviewer has a mapping tool called Epi Mapper, and it is freely available, I think, on the Epi Reviewer website. But for that, your coding needs to be in the Epi Reviewer, and they provide access to public in a very nominal cost. And if you do Campbell reviews, it is available free of cost to you as well. So through that Epi Mapper, these evidence and gap map can be developed.
But if you're not doing the Campbell review, you don't have access.
No, you can still have the access. Even if it's not a Campbell review, you can write to the Epi support and they provide the Epi reviewer at a nominal cost. And through that, you can have the access to the Epi Mapper as well.